But let's go across to a really special leader in the medical world, Prathap Reddy. He's the founder chairman, of course, of Apollo Hospitals. Thank you very much, sir, for joining us. We watched you for years build up this huge medical service. But do you feel that the corona situation, the pandemic, has raised awareness that India needs much more medical expenditure, medical care, develop our medical systems to a much higher degree, and this is really time to do it now?
Thank you, Pranay. I'm very happy to participate. We've been doing this from 2014. Our wonderful, generous Amitabh Bachchan as the ambassador in all of these. So I compliment NDTV and the ambassador. But I'm also happy Dettol is involved in this, because they're also doing a program. I have adopted 60,000 people in my Mandal, where I was born, from first breath to the last breath. That means the child before it's born, we take care of the mother. We give her nutrition 2 times a day, supplement her vitamins, minerals, whatever that is needed. And the delivery is done under our premises. I'm happy to say last 3 years, we had no neonatal or maternal mortality, because we were taking all the precautions to keep it safe in every single respect. And there, I think, infection plays a great role, especially when you talk about rural India. The hygiene is a very, very important aspect. I'm happy Dettol has played a significant role. Last 1.5 years they've been there, where they're tackling only the children. But what we are telling the children is take this lesson to your parents. So I think it has an impact on those 65,000 villages or 102 hamlets in the place where I was born. But your question was about this infection. What are we doing enough
the health sector in India?
The first answer is
in the health sector, yeah.
In the health sector, first, I should say, the government acted quickly. Whatever they thought was necessary, putting the controls, bringing back the essential equipment like PPPs and all of these, and then they geared up the healthcare community, the public healthcare. I must admire them, the doctors, the nurses, the paramedics, the whole lot. And the private healthcare, we also joined them and did whatever we could in each and every aspect, because none of us were prepared for this. This is where I think we learned the first lesson. What is needed? What are the medicine? Because there was everybody had no clue. It was only in the beginning a life-sustaining program that all the private or even the government or private hospitals, which we put them in intensive care units, what we did. But later on, we adopted the 3 things that have made a significant impact, especially when it is given. And the results are shown. Initial mortalities were close to 3%. Now, all, whether it's private or public, the mortality figures have dropped below 1.7, 1.5. Sometimes even in my district hospital, where we are handling, it is less than 1. So I think this is where we have learned the lesson, implemented it with our own adaptability. I think you can't give the same dose, same thing, because our people weight and things are different. So we have learned it. But what is most important today, the people who got into problem are people who were not just COVID infection. People also had other co-morbidities. I must tell you, way back in 2005 or 2006, World Economic Forum made a broad warning that second decade of this 20th century, will have severe crises from NCDs, non-communicable diseases. What are these non-communicable diseases? Diabetes, heart attacks, strokes, cancer, and infection. And I added the 6th one to it, obesity. These six morbidities will cause almost 80% of the deaths by end of 2030. That is in this 1 decade. And they've also said the cost burden for the world will be $30 trillion. For India, it's going to be $3.8 trillion. Why is $3.8 trillion, which is more than 50% of GDP? And to answer your question, should government spend more money than what they are doing now? They will increase from 1 to 1.2 to 1.25. So where is 50%? Where is this? I think what is reasonably required was, we have been pleading saying that if the government can cope up close to 3% and above, the private is spending now 5% through insurance. If that goes up to by 2%, if 7 plus 3, 10%, I think can make a significant impact in not only managing disease. I think we should now talk, when we talk about the future crisis or even the present crisis for COVID, our greater efforts is to see how can we prevent COVID infection. We set a 3 golden formulas for that. Similarly, I think for NCD crisis, what we have done is, we've done a large number of the health checks, probably the largest number in the world. Using artificial intelligence, we have now derived what's called a personalized health check, which can detect, when you do 5 people's blood samples, it's 5 different tests, but it's specifically focused if they have any one of these 6 COVID problems. If they have early enough, if it is diabetes, there's a sure cure for diabetes. I'm one of those. My blood sugar was 370 45 years ago when I was struggling for this Apollo. Today, my blood sugar this morning was 88. So I think it's completely controllable and all the complications of diabetes will disappear. Similarly, the most important is the heart. Unfortunately, the heart attack in the West and now India is different. In West, it takes place in 60s and 80s. Unfortunately, in India, it used to happen in 30s and 50s. Now even we see now 25-year-olds getting a heart attack. So I think it can make a very significant impact if they go through the checkup, find out the status of their health, and then listen to whatever prevention. So I think prevention, like you are here saying cleanliness will make a significant impact in avoiding COVID infection. There I think it has the NCD crisis.
Thank you so much, Dr. Reddy, for sharing your expertise with us. I think what you said, prevention is the key. We need to take care of ourselves and self-care. That's what we're talking about. Thank you so much for joining us.